in the newborn phase, I mean, I think it's really important to just kind of give the basics, the basic manual, the minimal is best, how not to, how to keep your child alive for a couple weeks, right? But then early on, I think it's really important with each visit, and I think one of the things that we focus on in pediatrics is giving anticipatory guidance. The first couple years of life, you're in here a lot. We see you when you're born, we see you at 2 weeks, 2 months, 4 months, 6 months, 9 months, 12 months, and that's just the first year. And it's still pretty frequent after that. And so at each visit, I think it's really important. Kids are changing so much in these first couple of years that it's important for us as, pediatricians, as nurse practitioners, as healthcare providers to really help, identify certain milestones that parents, should be expecting. Toddler years are really important for behaviors, right? We all know that, we've been there. So talking about behaviors, safety is huge, and I think that's one of the things that I personally have a huge passion for. I spent some time working in a pediatric emergency room and got a little bit of extra taste of seeing some things and knowing that things really can happen, accidents really can happen. And so I try and educate parents that even the best parents, even myself, who works in pediatrics, we all make mistakes, but our job is to try and make our environment as safe as possible for kids. And in those toddler years, anticipating that they're going to be crazy and anticipating how to deal with those, staying safe, helping them, figure out early education, which is so important to kids, helping them figure out where could they take their kids in town to kind of help them socialize with other kids if they're not in a daycare, and really kind of looking at the bigger picture, not just necessarily are they here for a runny nose or a cold, but the bigger aspect of being a kid. It's crazy because it's a changing world, and so I feel like a lot of things that used to be able to maybe wait a little bit later into adolescence, we kind of start talking about earlier in life. Electronics has become a huge thing that we focus on, and we try to at each well child check, starting really young, but especially in the elementary and early middle school age years, really kind of focusing in with parents on, how do we limit these screen times? How do we keep kids, safe? During the elementary school years, kids are really excited. Most of them really want to please and want to do well. And so that's a nice time to establish a really good rapport, whether it's a healthcare provider, whether it's parent to kid, but to try and teach kids early on about their health, how they can stay healthy, because if they can start learning these things and wanting to be healthy and wanting to be active early on, it's a heck of a lot easier than trying to make changes when you're later in life. And so I think that's a big thing in elementary school. Safety is another huge thing that I really push in elementary school. I mean, in pediatrics in general. Helmets, huge on helmets. Safety, bullying, all of that has become such a big part of what we do. I think adolescents come with a big, shock factor, right? I feel like you're gonna love it or you're gonna hate it, and I really like it. I like teens. I like talking to them, establishing with them that they have a special relationship with me as well too. Teenagers in North Carolina get a lot of respect legally, and so they get their own patient-provider confidentiality, which I think is super important, especially in these changing times when kids and teenagers are worrying about a lot more stuff than we may have ever even thought possible. Anticipatory guidance is huge. I'm trying to help kids before they even get to that point, how to make good decisions, good choices. Health, again, is huge, trying to get them excited about not wanting to drink, just soda and tea every day and be on their phones 24/7. I do tell every teenager that this does not count as your 60 minutes of exercise. Thumb exercise does not count as getting your heart rate up. I think teenagers want to know that they're in a place that's safe. I want a teenager to feel when they come to me that if they have a concern that they're not comfortable with telling somebody else, if it's about their health, if it's about their mental health, that they can feel comfortable with me and know that it's a safe place to talk with me. We've got some great community resources, and so I just like kids to know that we're here for them, teenagers especially.